More than 1.2 million people traveled through America's airports yesterday, according to the TSA. That's a record for air travel during this pandemic. Health officials warned that holiday travel would cause a COVID spike. So what's on the way? Joining me now, Dr. Amesh Adalja, senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, it's so great to see you today. Millions of people clearly did not listen to the CDC's advice to stay home for the holidays. We already know that December is the deadliest month of this pandemic so far. Is there any way, anything we can do at this point to prevent January from being even worse, or is the damage already done here?
A lot of the damage is going to be done. We know that people traveled. We know that people had private gatherings, and many of them probably didn't follow all of the common sense recommendations that we've been stating. So I do think we're going to see some level of increase in cases, increase in hospitalizations, and increases in deaths after Christmas, just as we did after Thanksgiving. I think it's really inevitable when you look at how much community spread is going on, and I think it's going to be tough days for hospitals in the coming weeks.
The good thing is that we are at least heading into the new year with vaccines. Our healthcare workers, long-term care residents getting those shots as we speak. I know that you got the Pfizer vaccine already. Could you tell us about your experience with it?
Well, I got vaccinated a little over a week ago, and it was the Pfizer vaccine. It was a very good process. I had no side effects, and I'm scheduled to get my second dose in a couple of weeks. And I think that this is something that gives me a lot more confidence taking care of COVID patients. I'm speaking to you right now from a hospital, and there are COVID patients just outside that door. So this gives me a little bit better peace of mind that I'm protected from severe disease. And I really think that this is a triumph of science, and it will be the way that we put this public health emergency behind us.
So I have to ask, because a couple of doctors that we've had on have answered this question for us, several of them saying it didn't even hurt as much as the flu shot. How much did that shot hurt, and were you feeling it a little bit afterwards?
I actually had no side effects at all. I didn't even have arm soreness.
Wow.
And that's less than the influenza vaccine. So I likely will probably see some more side effects when I get the second dose, because there's already some immunity that's been generated. So that will boost that immunity. But the first vaccine was basically nothing.
That's fantastic to hear. Dr. Adalja, drug maker Novavax announcing that it is starting phase 3 trials in both the U.S. and Mexico. What should we know about this particular vaccine candidate?
Well, this is a vaccine candidate using recombinant technology. So it's even it's another example of high-tech ways of solving vaccination problems that really are only available to us in the last decade or so. So this is another vaccine that I think we'll eventually see come to fruition, and it will be something that will add to the capacity that we have, and it will be another option that people have. And eventually, I think we'll have a menu of COVID vaccines, and maybe eventually we'll have certain COVID vaccines are better in certain groups, the way we do with flu vaccines, and give some to elderly individuals and others to other risk groups. So I just think in general, all of these vaccines, letting them all bloom, is one of the best things that we're going to see kind of as a consequence of the COVID-19 pandemic, because it's going to change the way we respond to future infectious disease threats, that these vaccine technologies found a way to actually prove their worth.
Dr. Anthony Fauci originally said that around 70% of Americans need to get vaccinated for us to reach herd immunity. Now he's saying potentially 85%, comparing this to the measles shot, which needs 90% to stop an outbreak. Listen to this here.
Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85. But I think we all have to be honest and humble. Nobody really knows for sure. But I think 70 to 85% for herd immunity for COVID-19 is a reasonable estimate.
Dr. Adalja, why is it so difficult to nail down that number that we need to reach herd immunity? And do you agree with Dr. Fauci here? Do you think it might be on that higher end, say 80, 85%?
If you're talking about the population as a whole, to be able to keep this at bay, I do think you're looking at the 75, 85% range. However, we'll start to see benefits when we get our vulnerable populations vaccinated, because that's what's really clogging up hospitals. That's what's taking up ICU bed space. That's what we're worried about on a day-to-day basis. And that's also what's causing a lot of the deaths. So once we start to get those groups vaccinated, I do think we'll start to see a benefit. And you have to remember that when you look at herd immunity, it's a hard thing to calculate, because you have to understand whether or not the population is homogeneous homogeneous or heterogeneous. And we know that not everybody contributes to the spread of this virus, that maybe 20% of people are responsible for 80% of cases. So we may get to a benefit of herd immunity before we actually cross that threshold. But clearly this virus is more contagious than influenza, but it is less contagious than measles. So I do think that Dr. Fauci's calculation is correct.
Dr. Adalja, over the weekend, the CDC issued guidance for adults with underlying health conditions, including autoimmune diseases, saying that they can get vaccinated. What should our viewers know about that latest guidance?
Well, we know that people who have autoimmune diseases and other medical conditions are at the highest risk for needing hospitalization or dying from this. So in that situation, the risk of the vaccine is outweighed by the benefit. So I do recommend individuals with autoimmune diseases get this vaccine. And I think you'll start to see more data based on the clinical trials and the experience of those individuals getting vaccinated to give us more information about this group. But it is a group that we want to get vaccinated. We need to get our vulnerable populations vaccinated because that's how we really disrupt the damage that this virus is causing to society.
How about the timeline for the vaccine? Operation Warp Speed, the federal government hoping that we would have some 20 million Americans vaccinated by the end of this year. It's now December 28th. It looks like only about 2 million vaccinations have happened so far. What does that mean for the timeline? Do you expect that the average person waiting to get a vaccine will now have to wait even longer because we're so far off track? Or is this just part of the process when you're rolling out something that you've never quite rolled out before?
I think it's part of the process. We know there's going to be hiccups and glitches. It's not going to go off completely exactly as we planned. That's what happens when you're doing a major public health endeavor. I do think, though, for the general public to get this vaccine, we're looking at late spring, summer. I think that timeline is achievable. It's in the realm of possibility. And you have to remember that we're getting better at this every day. Hospitals are increasing the rate of vaccination. It started out slower. It's getting faster and faster. So I do think we'll get to a point where we can likely get the population eligible to be vaccinated by the summer.
Dr. Adalja, I know I need to let you go, but one quick question before you do. New Year's coming up the end of this week. Your advice for folks for how to stay safe?
Just remember that the virus is going to be with you at your New Year's celebration. So that doesn't necessarily mean you have to lock yourself at home, but it does remember that you need to think about where you're going, who you're going there with, try to limit the number of people that are there, try to wear a face covering. If you can do things outdoors, if you can open a window, all of that is going to decrease the spread of this virus during New Year's celebration. I think that we know people are going to take these risks. I just want them to have the tools at hand to be able to lower that risk.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.